you're going to have to determine how many people you have in your OR and how many gowns you need. With every gown you need a towel, and then if they double glove you need both sets of gloves. Stack it up on your table in the sequence that you would use it. So the first thing that would happen is if my surgeon had scrubbed with water and an antiseptic, I need a towel first. We never know for sure, so you're always going to have a towel. Maybe they AvGuard or use the Sterile, but always have a towel in case. Next is the gown, and gloves are last, so I'm going to put that on the bottom. If only one set came in your custom pack, now's the time to say to your RN, hey Nicole, is John the PA scrubbing with Dr. Z today?
Not today.
Okay, then I guess I don't need his gown. If he did, then I would. Then I need to know how I'm going to drape. And if we were doing a laparotomy case, you would use a lap drape, and you would have 4 towels to square off. Now, dependent upon the type of towels you use, if they're the blue cloth, you may or may not secure them with perforating towel clips, or you might use an IO-band, and it'll say on the preference card what your doctor likes. So I would need 4 towels, at the very least, to square off with a lap drape. Then I may or may not need an IO-band, or I may or may not need my perforating towel clips. So if I'm going this way, I might as well take everything that needs to go this way. So I'm going to put my gloves on the bottom, my gown, my towel, and if I had 2 or 3 more people, I would stack it up. I have my drape, and I'm using my towel. So I would say to Nicole, can you get me another pack of towels? And Nicole would then get me another pack of towels. And maybe they come with 4 towels, maybe they come with 6, whatever. And I would put my towels out on here. And then once I get that drape, now you're not going to just stand here and wait. Let's say that Nicole ran out of the room to get a pillow or something sailing. So you just don't sit here and wait twiddling your thumbs. So Nicole's not there to get them for me, I'm going to keep them. And so now I want to look at my instrument. And remember I said that this is an Abdominal Explorer, so in this case we're entering the peritoneal cavity. So that would mean that I would need to count. And so I would then, because of it, your retractors are going to come on top of your tray. So you want to get them out of the way so you can count everything. So here would come Nicole, and I would grab my towels, and I need 4 towels. And actually we would hope it would come with more, because what I would really like to do is to lay a towel down here for my sharp instruments. So we'll pretend Nicole gave me more. She's a little skimpy here on my towel. That's all right. So we'll pretend she gave me another. So I have 4 towels. Well, I'm over here now. I'm not going to worry about this just yet. So I'm going to put them there. I'm going to finish what I'm doing here. So I like to lay out a towel to put sharp things on. I'm going to take out my retractors, because I'm going to have to count these. And I'm going to lay kind of my like retractors together. Alright. Now, the next thing I want to do is I want to make sure, actually I should have done this first, I'm sorry, is to make sure before I took those out that everything was unclamped. Now, don't lift up this ring forceps that's through the finger rings on each instrument. Just lift it and make sure everything is unclamped, because if one instrument in here is still clamped, then the whole tray is contaminated, not to mention my hands and whatever else I touch. So the first thing you should do is check for an indicator strip, and also to make sure that they're unclamped. And so we're going to say that they all are. Now, I am going to hand my instrument sheet to Nicole, and she's going to come over and we're going to begin counting. And typically we begin with our instruments here. And so I would say it's a good idea to grab something like a scissors or your knife handle and go. This would be how it would go, and I won't finish the whole thing, but it would be 1, 2, 3, 4 curved mosquitoes, 1, 2, 3, 4 curved Kellys, 1, 2, 3, 4 Carmels, And there's some Kellys that are mixed in here. That shouldn't happen. All your like instruments should come in a row. But needless to say, I'd go 2 Kolkers, 3 mixtures, whatever, and I would count all of these. Then we count our tissue forceps all together. We don't say like one long Russian tissue forceps. It would be 1, 2, 3, and I got pretty skimped. It'd be pretty common to have maybe 7 to 11 tissue forceps. We count our scissors together. Oh, here's another one, 4. Our scissors get counted together. 1, 2, 3. You count them total. Our knife handles. I've got 2 short number 3s, 1 long. Our security call clips are counted with the med cup, and so I would say 4 security call clips, and then we're going to count all our retractors together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Now, if Nicole said, I got 12, count again, we would count again. And then I have the stringer, as we call it, that went through the instruments, but this is a sponge ring forceps, so I have 1 of those. So that would be how we would count. Now, this is how I like to set up. You have to reason out what you need. I like to start with my knife handles. And so I know in this case that I would like 1 for the skin, and we never use the skin knife again. So I have a short number 3 that I'm going to put a 10 blade on. Another short for when we go down further, and as we get deeper, a long number 3. So I want all 3 of those. And you want your RN to have given you your blades. Sometimes they'll come in a foil packet in your custom pack. Now would be the time to open it up and always put it on with a clamp or a needle holder. So we haven't learned that yet, but I would put all my blades on now. Alright, next I'm going to go to my scissors, and in this case I know that I'm going to have a suture scissors. I like to put it here, followed by my Mayo and Metz, and in this case I would want a longer Metz scissors too. Look at your patient when they come in the door to see how large they are, and if you even need a longer one yet that didn't come in your tray, you might have to ask your RN to go get one. Some people flip these. It doesn't matter to me. You'll find what works for you. Next I'm going to go to tissue forceps, and remember I said I want something with teeth and without, and I want short, maybe medium, maybe long. And so this isn't, I would need more than this, but this is kind of a sampling. Now, you're going to have many tissue forceps. A lot of people like to put them back on their tray, the extra ones. Sometimes they'll put tissue forceps with teeth facing this way, and maybe without facing the other way. You could have done it on this side. What I don't like is that you do it on the outside of your tray. I like you to keep them on the inside of your tray. So we have knife handles with our blades, our scissors followed by our tissue forceps. Now I'm going to look at clamps. And I know in this case that I am never going to want mosquitoes. So I'm going to pull out my curved Kellys. And let's say that I want to put 4 up. They should be in the tray unclamped. So you're going to just clamp them. Put them up on your mail stand. Now, I know in this case that we're going down into the peritoneal cavity. It'd probably be wise to have some carmels. Maybe I want 2, maybe I want 4, maybe I want 6. You can put them together, you could separate them a little, you can decide. And if I were really doing an Abdominal Explorer, I would also be looking at things like Vanderbilts. I might want some bowel clamps like Doyens and things like that. And so you could put those up also. And after we go to clamps, we're going to go to graspers. And so Kolkers are a really good choice. Because we're working with bowel, we might want some Babcocks, maybe even some Alices, and possibly some longer Kolkers, and maybe longer Alices. So we'll just say, we'll just put this little assortment up here. And keep your mail stand simple. Try to get these so they stand up. And truly, in a case like this, you'd probably have a few more instruments. And then we would want to have our miscellaneous, like our right angles, some mixtures, things like that. And then lastly, we're going to think about retractors. But you know, it would be hard to get all my retractors up on my mail stand here. So I'm going to set them out back here and kind of keep like retractors together. I know I'm not going to need a cerebellar for this, so I'm going to put that back in my tray. And I'm probably going to choose either the Cullens or the Army Navies because they're pretty similar. So I don't want the Cullens, I'm going to put those back. And cat paw rakes, I don't know about those. I might even put those back. Now what you want to do is have your needle holders down here with your suture. This is a very small needle holder. Don't need it. Came in my tray. That's nice, but I don't need it. And now I'm going to line up all my other extra instruments, and I'm going to keep them nice in here because you might have to reach back and grab some more. What I might do even is to take a security call clip and clip the drape here so they stay up and don't fall down. I have a med cup if I need meds. You might want to clip that to your tray. And I do know that I'm going to need a sponge ring forceps. But before I put that up, I might want to count them. So now would be the time, after you had everything set up, that it would be time to count. And remember, I needed to go back and get my 4 towels for my draping. Now, there's some different scenarios. You could have not draped out that table, and you could have put all your linen on your back table. You could have taken this and you could have put it in your ring stand. Everybody's going to do it a little bit different. Keep in mind cost. Keep in mind prioritizing what you, in an emergency, I probably would have never draped out this table. I'd have never had time to do that. So, lastly now, we're going to count. And so we would count by snapping our little paper strip to our longs, 10s, or Ratex. And the proper procedure is to separate these. So we would go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we would need to count laps. And I would rip or take off this strip. And make sure your RNC is the blue X-ray detectable string. 1, 2, 3, 4, 5. Where do you want these? If you want them moist, you could put them in your splash basin. You could have put them in your potty. Okay, now that I've counted this, I could make a sponge stick. Maybe I want to make 2. I could put that up on my mail stand. Your longs, 10s, or Ratex, which normally in Duluth we use the 4x8 length ones. So those go up here. And I'm going to kind of organize things. And remember, you would have a self-retainer like a Belfour or an Omnitrack or Book Walter. There's many different kinds. I would take my suction and put my yanker tip on because I'm going to use that before my pool, and my light handles. And I could choose to put those in my basin, or I could choose to put those up on my mail stand for when I'm going to drape. Or I could have chosen to put this on my drape table. Kind of a fun thing to do, I think, or a good little trick is to put your light handles over your blade handles, because what happens is the minute you drape, your surgeons grab for the knife. And if you haven't had time to throw off your suction and your cautery, there's going to be bleeding, and they're going to be saying, "Where's my cautery?" And you didn't have time to throw it off. You're just in the process. Well, they can't find the blades if you hide them. So hide them under your light handles. Now, I am missing cautery. And I would say then to Nicole, "I don't have a cautery, Nicole. Could you go get me some cautery?" So she would get me cautery. And so we would need to not only count our sponges, but we would need to count our blades. And so I would have to show Nicole how many blades I have. And then we would have to count our suture needles. And if I happen to have a hypodermic needle, we would count that. If I had a cautery caddy or scratch pad, that typically gets counted. If I had a tip to a electrocautery pencil, that would get counted. Any number of things that is required to be counted by your hospital policy. Now, let's just say that this case was not a open Abdominal Explorer and it was maybe a breast biopsy. And it is a local MAC. The first thing you're going to need is going to be your local anesthetic, so xylocaine, bupivacaine, whatever. So in that case, you would need a syringe and a needle, and you need to label your med cup and label your syringe, not on the calibrations. Then the first thing that might go up on your mail stand would be the meds in the syringe, because that's the first thing you're going to give before your surgeon starts to cut. And lastly, I'll say that some hospitals have a towel that comes in a custom pack, a bright orange towel that says timeout. So we don't forget the timeout, they may put that up here. Some hospitals have a marking pen that on the pen you slide off a little cardboard piece that says timeout. So they'll put that by their scalpel handles. Every hospital may do it a little bit different. So that's pretty much a basic setup, and pretty simplified, I might add, because you don't have a lot of stuff. You would have to add a Belfour and some bowel clamps, and you'd have probably quite a bit more instrumentation and equipment for this. But so your skill is to drape the mail stand and set up the instruments, to drape the back table, and to drape the ring stand. And that's it. Questions? Anybody have any questions?
We're not going to be counting sponges?
Not at not at this point. We weren't going to do it for a skill, but we are going to learn how to do that.
Yeah.
So, okay.
During the mock surgery again, are we actually checking the indicator inside, or are we just kind of...
Well, right. I'll put an indicator in your tray, and you should be able to tell me if there wasn't one. We always, always, always check for indicators in our tray, and always check the outside. Never assume. So.